So good morning, everybody. My name is Martina Gliber. I work at Institut Mérieux, a French holding organization. And I would like to thank very much the organizers of this event for having invited me, especially Louis Gresham, who is the CEO of Fondation MERIEUX USA. And yeah, I'm very happy to be here. So I will give you a presentation this morning showing you some concrete actions of public-private partnerships from the Mérieux Foundation. And then I would like to talk a bit about Institut Mérieux and what we are doing, and especially the needs for public-private partnerships in order to develop together new tools and work on R&D for new diagnostic tools for low-income countries. So I don't know who of you have already heard about Mérieux. Many? I think not really, yeah. So just a few. So who is the Mérieux family? So Mérieux family comes from Lyon, and they set up in 1897, thanks to Marcel Mérieux, who was a pupil of Louis Pasteur and Emily Roux, the Institut Mérieux. And the Mérieux family is really a family that is dedicated to global health since many years. We have Marcel Mérieux, who worked on anti-diphtheria serum. We have Charles Mérieux, who set up the Foot and Mouth Disease Institute in France, working a lot also on vaccines. Then you have Alain Mérieux, the son of Charles Mérieux, who set up bioMérieux, that is a diagnostic, in vitro diagnostics company. And all of them are really dedicated to global health and to international health. And Charles Mérieux, for example, helped to produce vaccine in the meningitis epidemic in 1973 in Brazil for around 90 million people. So they really would like to improve access to health in countries, emerging countries and developing countries. So this is just to show you that Fondation Mérieux is a family foundation. So it's independent from the industry group. Then we have Fondation MERIEUX USA, that is an American foundation, 5013. So also independent. And then you have the industry group with several entities like bioMérieux, who is the biggest one, Transgene, working on immunotherapy, Mérieux Nutrascience, including Silica, maybe you have heard about, on food security, ABL, who is here at the in the United States, and Mérieux Development. So working on the prevention, diagnostics, and also therapy of diseases with a complementary approach. We have a worldwide presence with companies in more than 40 countries, 30,000 employees, and sales of over 2 billion euros. So what is Fondation Mérieux? So Fondation Mérieux was created more than 45 years ago with the objective to strengthen local capacities of developing countries to reduce the impact of infectious diseases on vulnerable populations. And we're doing so with two major programs. One of the programs is to strengthen research capacities in developing countries. And the other objective is to strengthen health systems, working really directly with the ministries of health in developing countries. And that's on the health system component that I would like to show you an example of the West African network of laboratories that is called RESAOLAB. And you will understand why it's important, especially also in link with Ebola. So what is the objective of this network? So the objective is really to improve the quality of clinical testing in 7 West African countries by strengthening the laboratory systems through a multidisciplinary and inter-country network. So we set up 6 objectives that are very close to the objectives of a health system adapted to the laboratories. So the importance of improve the quality of laboratory services, the importance to develop, motivate, and train the laboratory technicians and all the laboratory professionals, implement laboratory information management system. So this is all about surveillance and how to get the laboratory data into the national surveillance programs, to improve access to better diagnostic tools in these countries. But what is also very important is to increase the funding for laboratory systems and for diagnostics there, because laboratory system is really a very neglected part of the health systems in developing countries. And then last but really not least, to strengthen laboratory governance within the Ministry of Health. And there you often have a direction that is dedicated to drugs and laboratory, but most of these directions are regularly focusing on drugs and not really on laboratories. So we would like to push these countries to have a dedicated directory on laboratory and diagnostics. And here we have 7 countries that are involved in this network, and I will show you in a minute which these countries are. But the objective of such a network is really to create a locally owned network that can run by its own and that cover not only the 7 countries, but really all countries involved in the ECOWAS region. So here you can see the different countries involved in the network. We have Senegal, Mali, Burkina Faso. These are the first countries that were already involved in the first stage of this project from 2009 and to 2013. And then 4 other countries joined the network recently in 2013. Countries are Benin, Togo, Niger, and last but not least, Guinea, very important because of the Ebola crisis. So this is network is a budget of around 12 million euros. And who are the public and private partners of this network? So at the first level, I put the ministries of health of these 7 countries, because they really have the leadership in the program. They are the beneficiaries, and they are really necessary for the sustainability of such a network. And they're very active partners, and they even contribute within-kind contributions to this project, make available laboratories, personnel costs, and so on. Then we have Fondation Mérieux, who is the coordinator of this network, who initiated the network. And we are also a funding partner of this network. We have a big support from the French Development Agency, Agence Française de Développement, who has been a funding partner since the beginning of the setting up of the network. A new funding partner is the Islamic Development Bank, because most of these countries in West Africa are member countries of the Islamic Development Bank, and they agreed to join the network. We also have the International Corporation of Monaco as a funding partner, mainly focusing on Niger, who is one of their target countries. A foundation that is called Stavros Niarchos Foundation, a Greek foundation, who accepted to contribute to this project. And then 2 operational organizations that are very important. We have the West African Health Organization, WAHO, who is very much involved in the harmonization also of training programs in the region. And we are also working together with the West African Health Organization on another complementary project called WARDS, West African Disease Surveillance Project, covering all West African countries. And WHO, of course, also a very important partner. And we are working with the WHO Lyon office, who is responsible for IHR partly, and also for lab capacity building, and also working with WHO Afro, responsible for the region. So how are we organized? All these different public and private partners are member of international steering committee that meets about twice a year, and currently we have a meeting in Togo at that moment. So all the funding partners and the operational partners and international partners are regularly taking part in this international steering committee, looking on the objectives, on the milestones of the project, on how the results are achieved, and if necessary, how to reorient the project, and especially that's what we did with the Ebola crisis. It was necessary to integrate additional activities because of Ebola. And then in the different countries, we have national steering committees, and these are under the leadership of the Ministries of Health and the laboratory direction, and they involve all national partners that are important for laboratory and diagnostic activities. So it's important to really, when you would like to set up these national laboratory networks, you have to involve the national programs, you have to involve also other directions, Ministry of Education, NGOs, and all types of actors involved on laboratory activities. And the manager of this project in each country is always somebody from the Ministry of Health and from the laboratory direction, because it's important for us to assure the sustainability, that we really strengthen these national institutions. So what have we achieved in the first phase of RESAOLAB? We were able to set up national training plans for the laboratory staff in each country, and these national training plans are harmonized within this first 3 countries, because the first phases was on the first 3 countries, Mali, Senegal, and Burkina Faso. So now every country has a training plan in place, and they started implementing this training plan with continuous training modules that have been established by several countries. So one country was responsible for one training module, and they worked together in binôme with another country to validate this program, and that has been then in another step validated by all the 7 countries. So now we have training modules on quality assurance, on biosafety, and so on in place that are running in all the 7 countries. We trained also local trainers. Very important, because the trainers were not really in place at the beginning of the program, so it was necessary to train them. We implemented around 70 training sessions with training of about 2,000 health personnel. And we were also able to rehabilitate training centers, because there were not in place training centers for practical training, you know. It's good to have theoretical knowledge, but you also really need to have practical training on laboratory and diagnostic activities. We also set up national quality plans. So what is the objective of the Ministry of Health in implementing quality assurance on laboratory in the countries? And the same as for the training plans, they are harmonized within the different countries. And we developed together with EpiConcept, a laboratory information management system, helping the laboratories to better manage their data, and also to send the data from the district level to the regional level, from the regional level to the national level, and then to do some data analysis on laboratory data. And finally, we were able to establish this laboratory direction in Senegal, where in the beginning there was a direction on pharmacy and drugs and laboratory. And now we have a dedicated laboratory direction there. So what about the urgent need to work on Ebola? Once there were the first cases already last year, we were alerted by our colleagues from Guinea, and they asked us to help them also to contribute to the public awareness of the disease, and also to rapidly set up some protocols for the sample collection. You probably know that the Ebola virus was firstly confirmed in the BSL-4 laboratory in Mérieux, that is in Lyon. So we set up together with our partners a protocol on how to safely collect the samples and send them to this laboratory in Lyon, and to be able to give back the results of this analysis within 3 days. And that's also important for the countries that are really not for the moment concerned by the disease. But if there are first cases, they would like to, it's important to rapidly know if it's Ebola or not. So we are doing the same with all these countries of the network. We also set up very early dedicated training modules for the laboratory staff on how to protect themselves. We had to provide them protection kits because nothing was available in these countries, no gloves, nothing. So that was not easy to get the material in time there, but we managed to do so. And when still others said there is the need to do something, we were really one of the first who equipped these people with the necessary material, and to train them also on biosecurity and how to deal with the samples. Together with the German Development Agency, GIZ, and the European Commission, we set up projects on mobile labs, and there will be a mobile lab very soon in Mali. Within the next 2 months, it will be available, and also one in Senegal in order to help to locally diagnose the disease, because the diagnosis is really crucial if we would like to avoid the epidemic to get spread. And we now also, together with our Fondation MERIEUX USA, we really would like to share this experience with the other English-speaking countries. We are currently translating some training modules and so on in order to share this experience with, of course, Sierra Leone and Liberia and other English-speaking countries that could be concerned by the disease. We also set up a website where the different countries can share their guidelines, they can share their experience. We set up e-learning modules also on biosecurity and how to protect the laboratory professionals. And all this material is on the website, a web portal of RESAOLAB, and accessible for the countries, but also for other countries who could get information that is necessary. So if we would like to have some lessons learned from this experience, I would like to get back to what we said yesterday, that it's really necessary in the beginning of the project to do a local needs assessment, to involve the beneficiary countries and the Ministry of Health, and to assess together with them what are the concrete needs and how can we help them. So that was not a project that has been written somewhere in Paris or in Lyon at the office, but we really started to do this needs analysis in the countries, with the countries, and defined then the priorities of the projects. And we defined also together from the beginning with the different partners who are involved, what are the roles of each partners, what are the responsibilities, and what are the, what each partner, what are the expectations in this project for each partner. I told you also that every partner is actively involved in the project governance, with different meetings taking regularly place. And they all signed a kind of a manual of procedures where we said who is responsible for what are the objectives, also for buying equipment and so on. So it was necessary to have some kind of rules on how things happen from the management point of view. So all that is it's clear, and everybody signed, and we know how to move forward together. And what is important also, I think, is that the coordinator, as we see our role at Fondation Mérieux, is a facilitator. It's not the coordinator who is doing all the work for the others, but the real actors are the beneficiaries, and they have their responsibilities to move this project forward in their countries. And our role is really to coordinate between the different countries and to make sure that things are moving forward smoothly, to get back to the funders also, and to be responsible for the overall communication. But the leading actors are really the beneficiary countries who are responsible also for sustaining the project. And I think thanks to this public-private partnership, we were really able to advance public health and laboratory strategies and policies in these countries, but also at a regional and international level. What is very important, and it has been said by almost everybody, but it really has to be underlined, is to foster trust Trust is so important in partnerships, and if the partners do not trust each other, it's almost impossible to work together. We were able to leverage, thanks to this partnership, additional resources from the World Bank, from the German Corporation, from the European Commission and others. And not only from the international partners, but also what is very important, we were able to increase the national budget dedicated to laboratory systems in the country. And that is really crucial for us, that the national budgets are if it should be sustainable, they cannot always be, you cannot not always be dependent on external partners. Of course, it's important. But it's a real success, I think, that in different countries, the budget for laboratories increased. We played an important role in Ebola preparedness, and I think we really had an increased impact in the strengthening of health systems. Just a few slides to show you that Fondation, very few slides, to show you that we are also setting up at Fondation Mérieux a research network that is called GABRIEL, so focusing on research of, we mentioned MDR-TB, so we are working on multi-drug resistant tuberculosis, pneumonia, and diarrhea. And so what are the needs for public-private partnerships for new tools? We think that there's a need for improved diagnostic tools for infectious diseases affecting developing countries. So this is from the point of view of Institut Mérieux. There is often a high cost for R&D and a long time between the investment and the commercialization of new products. These diseases often have not really a commercial interest for companies to invest in. There are technical risks to be shared, and it is necessary that the technologies are developed together with the different partners in order that they are uptaken. So with bioMérieux, for example, we have R&D sites in different countries, and now the objective, very recent objective, is really to focus on Africa, where there are not collaborations in place for the moment for R&D, and we would like to work in partnership to set these collaborations up in these countries and to work in the framework of a global tropical infectious disease program on new tools, diagnostic tools for emerging diseases and for neglected tropical diseases. And antimicrobial resistance and the detection of antimicrobial resistance is an important part also on that. Especially that's very difficult. Information is lacking in developing countries, and we need to work more on that. So we have some diseases identified we would like to work on: malaria, dengue, Chagas, schistosomiasis, leishmaniasis, sleeping sickness. And these diseases have been selected, firstly, because of the medical value and the need of the countries, but also, of course, because of the market interest and the funding that is available. And so, yes, we are here in order to identify new partners. I don't know if the medical associations in the countries have access to good partners, research partners in Africa, for example. We would like to work with the public sector, with NGOs, with academics, with the private sector. And really, I think from my background, you heard I was with Fondation Mérieux for 14 years, the last 14 years working on international partnerships. And I really insist now to Institut Mérieux that they have to work with researchers from these beneficiary countries. And they really have to go there and to understand the needs, some practical needs, also some technical needs, and really work together with these researchers. And I think, Corrad, we will certainly get in touch with you also to see how we can work with trained researchers in Africa or in other countries in order to develop new tools and in order to make sure that the tools really are targeted to the needs of the developing countries. So thank you very much, and sorry for being a bit late.